Hi, this video is the art of hair transplant restoration surgery on a black African American woman who had a thinning frontal area and on the temple on the sides, and have a receding hairline. You know, braiding can cause hair loss and it's called traction alopecia. However, not all black women who braid their hair has this hair loss pattern. And you have to have a genetic factors, and it's a very unique inherited type, and so it's really a gene passing on from one generation to another. Sometimes you can skip one generation, but you know, again, you cannot blame all the hair loss due to traction alopecia. What braiding does is it accelerate the hair loss, but you have to have a genetic factor, because a lot of black women who braid their hair, and you don't see they lose their hair. And why? Because they do not have a genetic factors to be susceptible to braiding, and braiding just accelerates the hair loss. And with or without braiding, you can still losing it eventually just through time. But braiding will accelerate the hair loss faster. You know, medication can help, and I recommend medication too, such as Rogaine. You apply it twice a day. However, not all medication will work, and if it does grow, you know, more like a peach fuzz, to tell you honestly, or it slow down the hair loss, and you have to take medicine for the rest of your life. Or you can use surgery, and surgery is the most effective treatment available nowadays. However, you got to find someone who specializes in the art of restoring black woman hairline, because this is your face and it is very important. You want to have the most natural and dense. As you know, I'm one of very few hair transplant surgeons specialized in the art of restoring black woman hairline. So on average, from the mid eyebrow to the hairline for women is around 5 to 6 centimeter. For black men is 6.5 to 7 centimeter, and Caucasian around 7.5 to 8.5. The other important factor is the temple, where the eyebrows end. For men, you put a thumb, and that's where the temple begins. And for Caucasian men, most acute backward. For Asians, less, and black men perpendicular. But for women, the temple begins where the eyebrows end, which is up here, not back here. So we had to bring it up here. And the other important thing is not only the temple tip corner not only start more closer to the mid portion, but its point, instead of pointing backward, it's actually pointed forward toward the midpoint. The other important difference is the zigzag. It's higher in amplitude and wider compared to men. And so I'll go to restore her hairline, as you can take a look, see, and look down. And again, turn this way. And there are treatment for this, and the best treatment is really surgery. So we have a nice zigzag to it, and we follow the natural facial structure. Again, hair transplant, especially hairline, is an art form, require a lot of the artistic and aesthetic detail to ensure a very natural result. And we'll be attempting around 3,000 grafts for this, and filling the front. And once we get the shape down, we will transplant at a very precise angle. For women, for black man, it's really flat against the skin, pointed forward. Asian man and Caucasian man is around 35-45. But for black women, actually most of them are flat against the skin and pointed back upward and flare out and pointed down. So precise angle is important. Selection of hair grafts is important. We try and plant rows and rows of single hair graft in the front, followed by root with 2 hair, 3 hair, and 4 hair in the back for bulk and volume. For the audience who want to know more of my work, just go on YouTube, type of black woman hair transplant restoration surgery result with 1 year post out with before and after photo by Dr. Diep, or call 1-866-999-6482. Thank you.